camera for the adoptable cats, but I don't know if it was another. Hello, everyone. Happy Friday. Welcome to the Houston SPCA's Pet Pawcast. I'm your host, Dr. Roberta Westbrook. And I just want to thank you guys for joining us every Friday to get information about how to take care of your pets. And I want to invite you to come on down to our campus for all animals. Our adoption center is open. There's no appointment necessary. All we require is a mask upon entry, but you can bring your family and friends and make a day of it. Come see all of the dogs, cats, puppies, and kittens that we have available for adoption, ready to go home to you. I want to introduce you to one of those sweet dogs that we have looking for her forever home. This is Tempie. Tempie is really a great dog. She is going to make a wonderful family dog. Tempie is the kind of dog who loves everyone. She knows how to sit. She knows how to shake. She's very food motivated, and she loves everyone. Her method of action is she is going to lick you until you can't take it anymore. All of the kisses that you can possibly handle. She's still going for Valentine's Day. She's giving out all of the kisses for Valentine's Day. Yes. So we call her Tempie Tappy here because she likes to tap dance when she's walking around. So come on down and visit Tempie and all of the wonderful pets that we have available for adoption. We thank you for adopting pets and having them be part of your lives for such a long time. When you make a commitment to an animal, that pet is going to be part of your life for 10, 15, maybe even 20 years. And that's a big commitment. And there's a really strong love connection that builds during that time period. And because that happens, I want to talk about a sensitive topic, which is when you've had a pet for such a long time and that time period is coming to an end. Maybe your pet has been diagnosed with a chronic disease or illness. Maybe there has been an accident that has happened, and you're considering whether or not your pet is having a good quality of life, and you're wondering when it's time to say goodbye. This is what we're going to talk about today. I'm going to help you navigate some of those questions and try to help you figure out when it may be time to say goodbye to your pet. It's never an easy decision. And so there's not going to be any black or white answers here, but maybe I can get you through it. So if you have any questions, please go ahead and submit those questions. Otherwise, I can start by giving you a few tips. So when our pets particularly are naturally coming to the end of their lifespan, for small breed dogs, oftentimes this can be, 15 years, 16, 17 years. Sometimes for large breed dogs, it's a shorter period of time, 5 to 7 years. But when we're seeing that our pet is showing signs of being, geriatric, maybe they're slowing down, maybe they're becoming more sedentary. They could be doing things like that are not normal for them. For example, having episodes of incontinence where they urinate or defecate out in the house where they used to be potty trained and go outside. Sometimes they may sleep longer than you've ever known them to. They may also not recognize you as well as they used to, or do things like greet you at the door that they used to do. These are all stages of animals going through what we call cognitive dysfunction, and it's a normal progressive stage that we see as animals get older. And you may be wondering, as I see my pet behave differently, maybe he or she is not eating, maybe they don't get up onto the bed like they used to, maybe they don't enjoy those walks, maybe they don't recognize you, maybe they've lost sight or hearing. When is a good time to know, is my pet suffering? And should I speak to my veterinarian about when it may be time to let my pet go? Does anyone have any questions or has been through this experience recently?
Cheryl wants to know, what if I'm not ready to say goodbye? I mean, is it cruel to not humanely euthanize?
Yes, what a great question. It's very difficult, and it's certainly not cruel because it's a hard decision to make. What we try to do is make very objective assessments on whether or not our pet is having a good quality of life. So I tell people who are struggling with this to make a list of what you feel like are your pet's good days. If your pet is having a good day, what does that look like for you? And then make another list. What does it look like when your pet is having a bad day? And you can have a little jar, maybe just a little ceramic jar, and you can use pennies. And you can say, every day I'm going to assess my pet. Every day that my pet has a good day, I'm going to put a penny in the good jar. Every time my pet has a bad day, I'm going to put a penny in the bad jar. And you can look at that over about a month's period. And you can say, look at it objectively and say, wow, I think my pet is having more bad days than good days, or I think my pet is having more good days than bad days. Maybe we still have some time together. But please don't feel like you are being cruel if you have not been able to make the decision. You may need help working through that. And in that case, I would recommend seeing your family veterinarian, talking to them about the changes you're seeing in your pet, and letting them help you work through whether your pet is really enjoying a good quality of life.
So Jane wants to know, is loss of appetite and an inability to walk, is that a sign of some things to come?
Right. So let's say your pet is not eating, and let's say your pet has lost the ability to walk. Let's talk first about not eating. A pet that's not eating can have a long list of potential causes for that. So just because your pet is not eating does not necessarily mean that your pet is coming to the end of his or her life. It could be a clue that you need to meet with your veterinarian to determine whether or not there's something that you can do differently to stimulate your pet's appetite or to treat a particular disease or a condition that might be contributing to that loss of appetite. So in and of itself, loss of appetite does not necessarily mean that your pet is coming to the end of life. Now, when it comes to not being able to walk or ambulate, this can be a sign also of injury or chronic disease such as arthritis. And in those cases, we have to decide, how can I care for my pet? If my pet is not able to walk, not able to go outside to urinate, defecate, how am I, as the pet parent, able to give my pet a good quality of life by helping him or her get outside? Am I able to do that? Because pets, especially if they're potty trained, they don't want to have accidents in the house. They want to continue to be able to go outside and to continue to have those experiences outdoors. If you feel like it may be too difficult to still allow them to have that freedom, you may want to talk to your veterinarian about options. Some cases, a wheelchair may be an option. But again, if your pet is too weak to walk, sometimes weakness can affect their ability to move in a wheelchair as well. And talking through all of the options would be the best thing to do.
So Joe says her dog has cancer, and she wants to know, do dogs suffer from chemo like humans do? And if so, what are they?
Yes. So if your pet has cancer and you are seeing a veterinary oncologist undergoing treatment, that can be chemotherapy, that can be radiation. Sometimes it includes surgery. A lot of the treatments are very similar to what happens in people who are diagnosed with cancer, and some of the side effects are the same. So you may see nausea, inappetence, vomiting, diarrhea, lethargy. You may even notice, if your pet is going through radiation, that they have skin disease as a result of the radiation, hair loss in the area that's being treated. So there are certainly some very similar consequences of undergoing those extensive treatments that we see both in pets and in people. And your veterinarian can help you determine how to mitigate those consequences, how to mitigate those negative side effects of undergoing treatment. Because again, when we're talking about quality of life, one thing that I've learned when I'm studying pain in pets is that they don't have the benefit of understanding why they are going through something. And that's important. When we as humans undergo an injury or an illness, we have a discussion with our family, with our doctor. We know what is going on with us, and we can decide in our minds, we can make a determination, how long might this last? What is the prognosis? How long might I be experiencing this discomfort? Animals don't have the luxury, you could say, of seeing far in the future. And so understanding that I'm in pain right now, and I don't understand when it's going to end, that's something to consider too, that pets don't understand why they're going through the pain that they're going through, and they don't have an idea about when it might end. And so some may use that as a parameter to say, this is going to be a very difficult 6 months or a year for my pet, and how do we feel about the quality of life that my pet can have while they undergo those treatments?
Jacqueline has a question. For younger pets, whatever their issue is, and the veterinarian recommends euthanasia, how do you process that when it's a young pet? And are there bereavement groups for pets?
Oh, absolutely. So typically when a young pet has a disease or an injury where we recommend euthanasia, oftentimes these are infectious diseases that have poor prognoses, or injuries. So things like being hit by a car where they sustain life-threatening injuries. And so sometimes it's very difficult in those cases with younger animals because it's less expected. Naturally, we expect that as animals age, they get closer to the end of their life, but we may not expect that for our 3-month-old or 6-month-old or 2-year-old dog. And so sometimes processing that can be more difficult because it's often more sudden. So when we have that, I would say, again, talk to your veterinarian about how to get through those difficult times and how to make those decisions. But oftentimes when animals are considered euthanasia when they're young, it's because the disease or the injury is quite severe, and a decision may need to be made fairly quickly.
So Jamie asked, is it better to humanely euthanize at home or a veterinary clinic?
Yes, there are several options for the location where a humane euthanasia may take place. So, what is humane euthanasia? Euthanasia is a technique that veterinary professionals have at their disposal to relieve an animal of pain and suffering. And it means that the pet will be euthanized or put to sleep or put to death permanently. And that's important to understand because some people may not realize what the term humane euthanasia means, but it means good death. It means that we want the pet to be able to transition from life to death in a very peaceful way. So one of the things that we take into consideration is the location. In the last moments of your pet's life, you can decide as a pet owner whether you want that to occur in the comfort of your own home, which certainly has the benefits of being more private. It has the benefits of having your pet be in a familiar environment around familiar people. And in some ways, that can be less stressful on everyone involved. You could potentially have a downside to that, which is you may not want to have a procedure like that in your home. Sometimes in the weeks or months afterwards, passing the spot where that happened or remembering the day that occurred could also create some emotion. And so you can talk through that with your family about which is better for you. On the opposite side, going to a clinic could mean a car ride to the veterinarian. And so if that tends to be a stressful event for your pet, then you can consider, I don't know if I want my pet to be stressed out in the last moments. I don't know if I want to be in the hospital with people that I don't know. So those are all things to consider. Both are very reasonable places to have a euthanasia performed. There certainly is no judgment one way or another. Veterinary hospitals do this on a regular basis. And so they know how to make the environment comforting and compassionate so that you feel as peaceful as you possibly can and your pet has a very smooth transition, and we're able to do that. The Houston SPCA is able to perform humane euthanasias for terminally ill or injured pets for the general public at no cost. A veterinarian will examine the pet and determine that is in the best interest. And so if you find yourself in a position where you think that could be necessary for your pet, you can certainly give us a call.
Do other pets who are left behind, is there a way to know if they're grieving, the other animals left in the house?
It's a very common question to wonder if a pet is in the home and, one of the pets passes away or is humanely euthanized, what happens emotionally to the pets who are left behind? And we do know that pets can experience stress from changes in their environment. And changes in their environment might be that their housemate is no longer there. Pets are particularly used to routine. And so if there's always been a housemate there that eats next to them, goes on walks with them, they sleep together, that change, not having the housemate there, can certainly be a stressful event for the remaining animals in the house. And you may notice that the pet that is remaining has some changes in his or her behavior, like not wanting to eat or seeming somewhat depressed. And some of that is they're not really sure what's happened. They know that there's a change. They know that their housemate is missing. They're not really sure what happened. And so it can take some time for them to get used to their new environment. But generally, the stress is related to a change. And so they may be experiencing some symptoms of anxiety. It's a good idea to keep your pet busy. The pet that is still in your home, interact with your pet. Keep them busy, take them on walks, get them toys that allow them to use their mind so that they can use puzzles, food puzzles, toy puzzles. Keep them busy and interactive and interacting with you. Those are going to be the best tips that you can have in order to get your remaining pets over a traumatic experience.
So how long do people grieve before they know it's time to get a new pet? Do you have any guidelines on that?
Wow, that's such a hard question. How long do people grieve? Everyone is very different, very different. And so certainly there are people who lose a pet and vow never to have another pet again. The loss is too difficult. And they have a hard time processing that. In those cases, I would really recommend seeking counseling, bereavement counselors to help you deal with that pain. It is a real pain when your pet is part of your family and you lose that pet. It can be very painful. I've experienced that myself, where you're crying weeks or months down the line because that pet has been so close to you. And so there's no time period. It can be weeks, it can be months, or it can be years. Other people may experience the loss of a pet. Perhaps it was something that was expected, that they were able to mentally prepare for. And because of that, they may be able to move on. And by move on, I mean, they may be able to get a new pet sooner. That emotion is still there. The heartbreak is still there, but they may be ready to love another pet sooner than others.
One last question. Can pets be cremated like people?
Absolutely. So you may be wondering, once my pet is gone, what options do I have for either viewing my pet's remains or getting a keepsake or a memento? And pets absolutely can be cremated. And when they're cremated, your veterinarian will work with a crematorium to return your pet's ashes to you. And so you certainly can have your pet with you as long as you'd like to, in a little keepsake of an urn. Certainly, if that is not what you would like, you can have paw prints made. You can have keepsake shadow boxes made like you see here. Some veterinary hospitals and crematoriums might be able to save some of your pet's hair or fur and put it in a little keepsake container. Or they can do these nice little framed souvenirs for you to memorialize your pet and to have this to remember your pet by in the years to come. So it's always difficult. Please make sure that if you are considering evaluating your pet's quality of life, to consult a professional, a veterinary professional. They can help you work through it. Don't try to go through these difficult times on your own. We are here to support you. Your veterinary family is here to support you. And if you ever need anything, please call our phone number. Well, we thank you so much for joining us and letting me answer your questions about pet bereavement. Please consider coming on down to our campus this weekend or in the upcoming week and take a look at the pets that we have available for adoption, including Miss Tempie here, who is still enjoying all of the love that she possibly can. What a wonderful dog, full of love to give to someone out there. So we thank you again. We hope that you have a wonderful weekend. Again, I'm your host, Dr. Roberta Westbrook. Thank you for joining the Pet Pawcast, and we'll see you next week.